So one of the questions in the rubric was asking, based on the previous concepts, deduce, explain, and dramatize the consequences of a hypothetical isolated injury of the motor and sensory branches of the axillary nerve. So the axillary nerve pretty much innervates majority of the deltoid, well, all the deltoid, the anterior deltoid, middle deltoid, and the posterior deltoid. And the deltoid is the largest muscle in the shoulder region. So if the deltoid was to weaken, that'll have a great impact on movement of the arm in the glenohumeral joint. Symptoms of isolation or isolated injury in the axillary nerve would include weakness in the shoulder area, a sense of numbness or tingling in the shoulder area. If you're not really able to perform regular functions like lifting your hands over your head or lifting up an object, pretty much flexion, extension, abduction, and adduction, if you have a hard time doing that, you may have an injury to your axillary nerve. Some examples of what can cause an isolated injury to an axillary nerve would be like being penetrated by a sharp object, such as a knife or a gunshot wound, blunt force trauma, for example, playing football, like any kind of contact sport. Things like that could cause you to damage your axillary nerve. As for an individual who most likely damaged their axillary nerve, some physical characteristics would pretty much be, I don't know if you guys have ever seen how a dislocated shoulder looks, but that's pretty much how the person's shoulder would look if they damaged their axillary nerve. So pretty much it'll look like their shoulder kind of caved in a little bit. And versus how this is just rounded out, it'll be slightly flat right here. And also another characteristic of a damage to the axillary nerve would be discoloration in the shoulder, kind of similar to a bruise because the shoulder has been dislocated. And some of the movements that would be restricted would be flexion and extension, abduction and adduction. Since the deltoid is weakened because the axillary nerve was damaged, those movements would pretty much be restricted.